All right, welcome to another installment of Rippel's Media Landscape series. Each month, we are sharing key insights, trends, and emerging signals that are shaping the future of thriving. In this video series, we explore what we're noticing across sectors and how these patterns can inform collective action toward a more equitable and thriving future. So for April 2026, a clear set of themes emerged. Philanthropy is shifting from funding isolated projects to aligning investments and resourcing the underlying conditions that communities need to thrive over time. Institutions and communities are more deeply weaving the vital conditions into their everyday work. And lastly, the narratives that we use to communicate about and support democracy and civic life are evolving. So diving right into this first theme, it's really building on a trend that we've actually noticed before, and also one that inspired our upcoming Rethink Health Toolbox webinar. And it's really about how, philanthropy is aligning investments to play more of a role in systems change, not just like through funding one-off programs. Philanthropy is really moving to invest in the conditions that help whole communities thrive over time. In this article, Philanthropic Boards and Systems Change, how to help navigate, not just evaluate. We're seeing how boards are being challenged to shift their roles from, scorekeepers of individual grants to more so navigators of complex systems. Instead of asking, did this one project hit its metrics? They're really being pushed to ask, like, how healthy is the broader system? Are we learning? Are we adapting? And what kind of funder are you really? That pushes this idea even further, asking funders to examine their own mental models. Are you a traditional charity funder, a transactional grant maker, or a genuine partner in systems change? This piece argues that when funders see themselves as partners, they fund differently, with more trust, more alignment with community needs, and more long-term outcomes, instead of just funding like proposals that check all the boxes. We're also seeing this in community health with Dignity Health Central Coast. They announced almost $500,000 in grants. These dollars were explicitly tied to unmet vital conditions that they identified in their community health needs assessments. So, things like transportation, childcare, food insecurity, behavioral health, financial stressors. So instead of focusing only on like funding clinical services, they're investing upstream in the conditions that shape people's health every day. So very similar to what we're seeing in philanthropy. It is what we're seeing in philanthropy. The Women's Giving Fund shows what this looks like through a different lens. Their grants across the region in the Inland Empire support nonprofits working with women and girls on safety, housing, economic opportunity, and healing from violence. These are not small, isolated programs. They're investments in power, security, and opportunity, which are really like the building blocks of long-term well-being for women, their families, and their communities. And this next theme here, how institutions and communities are embracing the vital conditions. We're just seeing how across the country, institutions and communities are doing more than talking about the vital conditions for health and well-being. They're actually like implementing them, putting them into work. So at Boise State out in Idaho, there's a story about Dr. Brittany Brand and the Resilience Institute. And, it's really showing what it looks like when lifelong learning is a vital condition that's being really focused on. They offer a short course through the Osher Lifelong Learning Institute that is helping Idaho residents understand, like hazards and risks in their communities, and to build confidence and relationships that can make their communities more resilient. It's not like just education for its own sake. It's really, learning and education as an infrastructure to create civic readiness and improve public safety. Zooming out, the National Academy of Medicine's Centering What Matters paper gives us a shared blueprint. It calls on health systems researchers public health leaders to align every action with individual and community goals. So instead of designing around like institutional convenience, they're calling it, it urges a shift towards caring accountability that's grounded in radical empathy, grounded in the vital conditions framework, and health systems that are driven by what communities say they need to thrive. So in other words, it's like treating people's like lived goals and experiences and local democracy as core to health. And it's not like, these aren't things that can be added on. In this other article about Rowan University, they're taking a similar approach to well-being. There's a recent forum highlighting how students, faculty, and staff wellness isn't just like a side program, it's really a driver of their institutional success as a university. When universities like bake mental health, connection, belonging, and support into their policies and culture, they're investing in the conditions that let people like learn, teach, and lead over the long term. So well-being becomes a part of like the operating system, not just some sort of response. And then we have this story from our friends at Black Voices News on from the ground in San Bernardino. The HEART initiative shows how all of this comes together in community health practice. Over 5 years, local government, health systems, and partners are working to address cardiovascular disease by connecting clinical care with prevention, education, and the social determinants that have kept heart disease rates high. So this isn't just about like treating heart attacks; it's about addressing the conditions in which people live, work, and grow older so that fewer heart attacks happen in the first place, which is, another example of investing in vital conditions. So, altogether, these stories show how institutions and communities are stepping into these roles. They're not just delivering services, but like actively cultivating the vital conditions for thriving. And, this is what it really looks like to take it from a framework into a practice. This last theme focuses on the narrative and communications angle for thriving together, how we talk about democracy and what social media is actually doing and how it's impacting civic engagement. We hear a lot about how like polarized and broken everything feels, but if you look closely at the data and the stories, there's really like a more complicated narrative emerging. So, the ways that we talk about democracy, the platforms we use, these can either like drain people's energy or, help some people like step into, civic life. So in this article, Social Media and Civic Engagement, Solutions Must Embrace Complexity, we get like, there's actually a really surprising picture here. So like heavy social media users are more likely to feel that their participation can influence policy, and they're more likely to show up and volunteer at community events. But at the same time, they're also more prone to like extreme or anti-democratic views in some cases. So this tension is telling us something important, that like social media isn't purely like civic toxin or a civic cure. It's an amplifier like within a fragile information ecosystem. So this article is like really calling for some nuanced solutions, like investing in civic education. We've seen that come up a lot in these reports. Treating community events and local gatherings as like civic infrastructure and really framing them that way and building them out that way. Helping people develop more like reflective habits in how they're consuming and sharing information. All of this instead of just like calling for people to log off and like abandon social media altogether. It's like really, how do we work with this within our, environment, society right now? America has more common ground than you think. It's blossoming. This article pushes back on like the dominant crisis narrative in a different way. It lifts up the idea that Americans actually agree on more than we're led to believe. We've seen this before. We've seen that data, and that this shared ground is just like beginning to show up in new campaigns and coalitions. I think we're seeing a lot of partners start to use this framing more in this research. So through the nationwide deliberation campaign and a people's proposal process, this article just really highlights how like everyday people are coming together to bridge differences and like deliberate and imagine what a healthier democracy could look like. It recasts like this public the public image not as like hopelessly divided, but as, a source of wisdom and energy that's just like waiting to be activated. So, side by side, these two articles are really like inviting us to shift our communications lens and like shift narratives. Instead of telling stories where media just like polarizes, we really need to, always think about like asset framing and, more like honest, like nuanced narratives. Like these same channels that can, spread extremism, can also, fuel volunteerism and local participation. And, underneath all that noise, there really is a common ground. And, there's ways to tell fuller stories and build better formats for dialogue and invest in that civic muscle that can turn our shared values that are under there into shared action. So to wrap up April 2026, again, there was these three themes, like philanthropy is like moving beyond projects to fund the vital conditions that make long-term thriving possible. Institutions and communities are embracing those conditions. Lastly, the stories that we tell about democracy and civic life really matter. So we're going to keep tracking how these signals are showing up and evolving in the media landscape in the months ahead, and how they can inform more effective and equitable action toward a thriving future. Thanks for tuning in.